Okay, perfect. So I'll just get started. So I'm Adriel. I'll be talking about the RNF213P R4810K variant and clinical outcomes in a multi-ethnic cohort from Singapore with Moya Moya disease. So as we all know, Moya Moya disease is a rare cerebrovascular disorder with a catastrophic presentation which has significant disability. The management is typically that of medical or surgical. In terms of the RNF213 gene, the PR4810K variant is a founder variant, which is quite widely seen in Japanese, Korean, and the Chinese populations. Patients have earlier and more severe disease. This gene actually encodes a cyclic E3 ubiquitin ligase, for which the precise pathophysiological role in Moya Moya disease still remains unknown. So the aim of this project was to see if this variant status affects the clinical presentation, radiological manifestations, treatment outcomes, and progressions in a multi-ethnic Moya Moya disease population in Singapore. So our methods, this is a prospective observational cohort study of 46 patients. We recruited symptomatic Moya Moya disease patients from a group of hospitals. We looked at the clinical data as well as a systemic evaluation of imaging markers, both in terms of imaging on admission and subsequently on follow-up. And subsequently, statistical analysis was performed, and we looked at the odds ratio as well as the multivariate analysis. So in terms of our results, the median follow-up was about 705 days. We did see that variants were more frequently observed amongst the Malay ethnic group, and also non-variant status was also associated with that of hyperlipidemia. We have found that there was higher familial clustering, a family positive family history was seen amongst variant carriers. In terms of our radiological results, we did find that variant carriers actually showed less bilateral disease, and variant carriers actually did show a higher amount of brain atrophy. In terms of subsequent follow-up imaging, there was no significant difference that we did see between disease progression, bilateral disease, as well as brain frailty. This is the univariate analysis actually pointed out the significant factors which we did find, and the multivariate analysis actually did show that Chinese ethnicity remained the only statistically significant variable that was independently associated with carrier status. So in terms of our discussion, we did realize that there is a need for population-specific genetic screening strategies, given that the variant seems to be present across all ethnicities in Singapore. In terms of clinical implications, of note, there was no significant difference in symptom severity, and this actually challenges the previous assumptions about genotype-driven risk stratification. Optimal revascularization is then hence considered to be effective. It should be considered independent of variant status. In terms of our neuroimaging, there was lower prevalence of bilateral disease, and also we did see there was higher brain atrophy. The strengths of this study is that it's the largest prospective genetic analysis of Moya Moya disease in the Southeast Asian population, and it's the first data in several ethnic groups such as the Malay and Indian population. The limitations is that while we are limited in terms of our sample size, it is a limited power to detect more subtle associations while still being appropriate for a rare disease study. And while there is a lack of a standardized protocol, it actually follows the pragmatic nature of real-world clinical cohort. Future directions, we hope to be able to expand clinical endpoints, looking at things, for example, like functional scoring of the mental status. And we also hope to consider systemic cascade genetic screening of at-risk family members. So in conclusion, this is the first comprehensive evaluation of this variant in the multi-ethnic Moya Moya disease cohort. And with the advent of genetic testing, we hope to incorporate it into clinical evaluation and allow for personalized surveillance and care strategies across diverse populations. Thank you very much.
Thank you, Adriel. Strong work.
Any questions from any of the judges or speakers?